This video will be about the HINTS exam, when to use it, how to perform it, and how to evaluate the results. So first of all, when should we perform a HINTS exam? It is quite simple actually. When a patient presents with acute monosymptomatic dizziness or vertigo, then HINTS is relevant. It is important to remember that we're talking about an acute onset. That means within the last day or a few days. And also that it is monosymptomatic dizziness. That means that if the patient also complains of other symptoms, for instance a headache, then we should not perform the HINTS exam. But even though we're saying monosymptomatic, it is actually okay if the patient complains of nausea and possibly vomiting as well. That is simply because the dizziness can cause nausea and sometimes vomiting by itself. But we can't do HINTS in all patients with monosymptomatic dizziness. That can lead to false results. We also have to see if the patient has something called spontaneous nystagmus. Nystagmus is a kind of involuntary rhythmic movement of the eyes. For spontaneous nystagmus, we observe if the eyes suddenly move quickly towards one side and then back to its original position. If it do so, then it is nystagmus. Nystagmus will occur repetitive for it to be proper nystagmus. And spontaneous nystagmus simply means that this repetitive movement occurs without any external stimulus. So now let's get to the main topic. HINTS is actually an acronym for 3 different tests. HI for head impulse, N for nystagmus, and TS for test of skew, or skew deviation, if you will. These 3 tests are performed one after another, and the results are evaluated together. So let's start with head impulse. For head impulse, you start by grabbing the patient's head, tell the patient to look at your nose, and keep looking at your nose. Then move the head slightly from side to side, and this is to make the patient relax his or her muscles, before you suddenly pull the head towards one side. Look at the patient's eyes and see whether the patient can keep focus on you or not. If the patient can keep focus on your nose, it is actually indicative of a central cause. A central cause means something in the brain. While on the other hand, if the patient can't keep focus on your nose, it is indicative of a peripheral cause. A peripheral cause means something in the ear. For the next part, we have nystagmus, the biggest part of the test. We have already checked whether there is spontaneous nystagmus or not, but now we have to describe the nystagmus more specifically. First, something we already talked about, spontaneous nystagmus. We have previously checked if there is spontaneous nystagmus at all, otherwise we wouldn't have performed the HINTS exam, but now we have to describe the nystagmus more specifically. And the first thing to do is to describe the direction of the nystagmus. And it can for instance be horizontal, as in the eyes moves towards one side. It can be vertical, as in up and down. If the eyes go both vertical and horizontal, then you can describe them as both. But it is very important to describe them as they go vertical, as the vertical movement trumps the horizontal movement. And lastly, it can also go rotational, where they spin around their own axis. This is very rare to observe. The direction, as in if it's going towards the right or the left, up or down, is determined by the quick phase of the nystagmus. In nystagmus, the eyes typically move quickly in one way and slowly in the other way. So if the eyes move quickly towards the right, for instance, and then slowly back towards the left, then we can say that the nystagmus is going towards the right. Next, we have to describe the frequency. Frequency means how often the eyes make the repetitive movement. In a high frequency nystagmus, the eyes will move more often back and forward in a similar manner as shown, while a low frequency will move less frequently back and forward, like shown here. And lastly, the amplitude. Amplitude describes how far the eyes move from their original position. The amplitude can be low, as in the eyes moves just a little, and it can be high, where the eyes move further away towards one direction. So that was spontaneous nystagmus. And now let's talk about gaze-evoked nystagmus. Gaze-evoked nystagmus means that we can see whether there are nystagmus when the patient is looking in different directions. So tell the patient to look towards one side and observe for nystagmus. It might be beneficial to hold a blank piece of paper up in front of the patient's eyes, and this is to prevent the patient from fixating at an object in the room. If the patient fixates at an object in the room, then it can actually suppress the nystagmus. And we will do exactly the same thing with the other side. Tell the patient to look at the other side and hold up a blank piece of paper to suppress the gaze fixation. Phew, that was actually quite a lot of information. I hope you're still with me. There's a reason why we have to describe so many different things. And that is because we have to evaluate all these findings together in order to see whether we have a probable central or peripheral cause. I highlighted some of the more important points here. A nystagmus with a low frequency, high amplitude, and that is vertical or rotatory points towards a central cause. While a nystagmus that has a high frequency, low amplitude, and is horizontal in direction points towards a peripheral cause. For the last test of skew or skew deviation, ask the patient to look at your nose and keep looking at your nose. Then cover one of the patient's eyes for a few seconds before you suddenly shift over to covering the other eye instead. Observe the eye of the patient. If the eye stays in the same position, it is indicative of a peripheral cause, while if the eye falls out of its position, we are dealing with a central cause. A positive test of skew is actually indicative of a possible lesion in the brainstem and should be taken quite seriously. To end off this video, I have made 2 summary flowcharts to help you remember the main points of this video. First, this flowchart shows you when you're supposed to use hints or when you're supposed to think about something else. And here is the hints test summarized into its own flowchart. Remember, if only one of the hints tests suggests a central cause, then a central cause like a tumor or stroke should be your tentative diagnosis. Thank you for watching. I hope it has been educational, and if you have any questions, feel free to post them below. Cheers!